Hello, my name is Maddie. I'm a PA student at Carleton University. Along with my groupmates here, we have put together a presentation about health passports. So, to start us off, I'll tell you about what makes up a health passport. So, first, you have your personal information, such as your name, your date of birth. This is also where you would include your emergency contact. The next component is your medical history, so your allergies, um, current medications, past diagnoses, past surgeries. We also like to include communication preferences and support needs. So, um, how do you best communicate? Do you need an iPad for communication? Do you need a translator? And then support needs such as what do you need to help you perform your ADLs and with medical procedures. Next, we include behavioral information. So if you have anything that would trigger you while you're receiving healthcare, and then how to help you resolve this when those things arise. Next, we include sensory information. So if you have any sensory issues pertaining to your medical care, we would put this here. Next, we have your decision-making capacity, so your legal guardianship, your power of attorney, etc. And then likes and dislikes. What would you like your healthcare providers to discuss with you? What would make you more comfortable? What do you like to talk about? Okay, next we'll be discussing patient rights and preferences pertaining to their health passport. First is privacy. You need to obtain consent from your patient before you include their personal health information in their health passport, and you need to inform them that this information will be shared with healthcare professionals. It goes beyond just your interaction. Next year, we have advocacy. So, as you're discussing your patient's health passport with them, um, let them know to include things that are important for them advocating for themselves. I think what sticks out to me here is how in the previous slide we discussed communication techniques and accessibility if they need assistance with certain things, and then sensitivities, what it is important to avoid and to help in potentially uncomfortable situations. Next here, we're going to discuss choices. So make sure you respect what your patient wants included and does not want included in their passport. It's important to have that autonomy.
Going into strategies for collaborative communication for IED patients, the first step I have here is to use simple language. So we should avoid medical jargon. Instead of saying we're documenting your comorbid conditions, you should say, let's write down any health problems you have. Keep these short sentences, concrete words, one idea at a time, so it's easier for the patients to understand what's going on, as well as using visual aids. Many adults with IDD process information better visually, so paint scale with faces, picture icons, body diagrams, things like that would be super helpful for them. Breaking it into steps, one step at a time. Don't complete the entire passport at once. So visit 1, we could do medical history. Visit 2, medications. And then visit 3, communication preferences. This just prevents any overload and confusion for the patients. And it's good to offer them choices, promotes autonomy. So instead of saying we need to add emergency contacts, we could ask, who would you like us to call if you're sick? Next is involving support persons when appropriate. Maybe family or caregivers can help clarify history, help with communication, or provide safety details, but it's important to always prioritize the patient's voice. And if the patient uses any assistive technology such as speech generating devices, communication apps, picture boards, or tablets, those tools should definitely be utilized during the process to make everything smoother and easier. And allowing extra time for the patient to understand the question that's being asked. It's important to pause, avoid interrupting, and allow silence so that these patients can fully understand what's being asked and give a solid answer. And the last step here is to confirm understanding using the teach back method. We could ask, can you tell me what we just wrote, or does this look right to you? Um, just to understand, just to see if the patient is understanding what we're asking, if any more clear explanation needs to be given. Going into strategies for collaborative communication.
The benefits of using a health passport is that it allows for improved communication with healthcare providers. It also allows for the patient to not have to repeat themselves multiple times, but it gives the provider what allergies, medications, medical history for the patient. It also provides more consistency in the treatment and allows for all your patient's information to be in one location and have the same details. A health passport can also enhance emergency preparedness by allowing all medical information to be on hand, which can be life saving. It also allows any provider to have access to a patient's information, which is helpful if a provider isn't familiar with the patient or is at a new area for work. And then finally, it also provides smoother coordination for a patient who has a multiple disciplinary care team. The benefits of using a health
Adults with IDD often face more fragmented care and communication barriers. Health passports help providers quickly understand the person's medical needs and their preferences. So, how we can educate patients and their families on the benefits. This gives safer care and better communication. We can also integrate it into their care routine. This helps to introduce during annual checkups and encourage bringing it to every medical appointment. This also helps to collaborate with providers. It promotes acceptance across hospitals and it teaches healthcare staff how to use the passport effectively. Adults with So for the accessibility and usability of an health passport, so you can add pictures, symbols, and color coding to make information way easier to understand. Important details such as allergies, medications, and communication needs should be organized and easy to find. It should be updated whenever health information, support, or medication change so that all the details are accurate. The goal is to keep the passport simple and helpful so that healthcare providers can understand and quickly see the details of the client's file. So for the
So, what alternatives for communication are best for people with IDD? Different people need different supports, so the best option depends on the person's strength, motor skills, vision, hearing, and preferences. Helpful alternatives often include AAC systems like communication books, speech generating devices, or communicating apps. Gestures and sign language will be helpful for other individuals, and written choices or keywords for people who read better than they process spoken language. So, what alternatives for communication? If the individual is having trouble understanding their communication partner, would you suggest changing your speech/voice and how? Yes. Speech can be adjusted when someone is having trouble understanding, but the goal is to improve clarity while still speaking in a respectful, age appropriate way. So use shorter, simpler sentences and speak a little more slowly, giving the person extra time to process information without rushing or overwhelming them. Pause between key ideas and emphasize important words so the main message stands out and is easier to follow. And support spoken words with visuals, gestures, written keywords, or demonstrations to make the message clearer through more than one channel. If the individual is having